Welcome to the Heart of Healthcare podcast. I'm Hallie Tecco.
And I'm Steve Krause. And every Monday, we bring you the latest in healthcare innovation as we sit down with entrepreneurs and industry experts.
So buckle up and join us as we figure out how to improve healthcare for all. Hello, listeners, and welcome back to the Heart of Healthcare podcast. I'm your host, Hallie Tecco. And today I am chatting with Dr. Jon Cohen, the CEO of Talkspace. Jon, welcome to the show.
Thanks. It's an honor to be here.
You started your career as a vascular surgeon, went on to be an executive at Quest, ran one of the nation's largest commercial labs, and now you're the CEO of a publicly traded digital health company. When you went to medical school, did you plan on your career path being so unorthodox?
Absolutely not. I only wanted to be a chairman of an academic department of surgery. The rest was totally circumstance, randomness, luck, whatever you want to call it. It was never, ever planned for this to happen.
Were there certain inflection points that you kind of look back at as key moments?
One is opportunities presented themselves to me, and I always was fairly aggressive about taking risk for certain types of opportunities that I thought were interesting. The other is I spent a fair amount of time learning and then speaking publicly about healthcare and healthcare reform for the country. And that had set me down a significant pathway for a lot of things that eventually happened to me.
You said the word risk. And when I think of physicians, I know they're quite risk averse. Do you consider yourself someone who takes on more risks than the average clinician?
Yes. I took on I was offered the chance to run the medical center, which I did. And I then became the chief medical officer of a very, very large health system, which I did. And then because of my interest in healthcare, ended up in politics. And then working for the state government, all because I was willing to take a chance.
What did you do in the government?
So I had an opportunity. I was very involved in the John Kerry presidential campaign on healthcare reform. And then after that, I had been speaking a lot publicly and was asked to consider whether or not I'd run for office. So I actually ran for lieutenant governor of New York on healthcare reform in 2005, 2006.
Wow.
It was a risky endeavor.
Yeah. I mean, I feel like very few physicians put their hat in the ring to become anything but maybe the Surgeon General.
Right.
That's very uncommon.
Yeah, it was. I had the same thing. I really believed in what I was saying in terms of some of the fixes for the healthcare system. And I had a lot of traction at the time. So I decided to do it. And I ran on healthcare reform, which people said, well, you're a single issue candidate. And I said, my response was always, the budget in New York is $200 billion. And at the time, $100 billion of it was on Medicaid. So I was able to talk a lot about healthcare and healthcare reform and for both the US and New York. And that's why I ran.
What role do you think other healthcare providers can play in pushing reform that can improve our healthcare system?
Actually, it's a great question. I've always believed that physicians should step up and step into the political environment to voice their opinion. And in fact, on even the publicly traded side and the private equity or VC side, I find that physicians' input can be frequently very, very, very helpful to investment decisions about what will or will not work or can or cannot work. And also have spent a fair amount of time talking about patient decision-making and physician decision-making relative to how they decide on healthcare. And I think it's honestly grossly misunderstood by many people.
Do you think that more clinicians should run for office?
I do. I actually do. I think they bring a lot to the table.
Yeah. I have noticed that more clinicians are interested in the business world, in entrepreneurship these days. What do you think that clinician leaders can bring to the business world that's really missing right now?
Well, I think, like I said, one of the biggest things is, most important things is understanding how physicians actually make decisions relative to delivering healthcare, what's good for their patients, and how patients actually make those decisions. So I spent 20 years as a provider. And then, like I said, then I worked on the delivery side, on the health system side. And those experiences were very, very important to me as I entered the for-profit side of medicine in making a lot of critical decisions about what we should or should not invest in.
Do you feel like there's stigma against going to that? Like, did you get any backlash from your peers about going to the dark side?
Yes and no. I do think, and talked about this in the past, that there actually is a glass ceiling for physicians. And what I mean by that is a lot of people view physicians in the way that they don't think that they can run anything, that they're very good at medicine, they're good at taking care of patients, but it really comes to business, that they don't have the operational experience or what's needed because they don't have an MBA to actually run a business. Of course, my response to that is the 10 largest, probably most important academic health systems in the country are run by physicians.
So how do you reconcile that, though, with the looming physician shortage we have? How could our healthcare system handle more clinicians going into business? And what sort of impact would it have on patient outcomes if our best and brightest aren't spending as much time hands-on with patients?
I believe, and I've always believed, that there's more than enough of a supply that very bright physicians could do one or the other or both. So I don't think the supply side is the issue. It's more. You don't
think that there's really a shortage, or you don't think that there's enough people leaving to worsen the problem?
I think that the shortage is in certain areas. The shortage, which has been going on for 30, 40 years, is in primary care. It's not specialty based. It's really in the OB, GYN, family practice, internal medicine, primary care is where there's always been a shortage. On the other side it's not quite evident that there's a shortage.
Let's talk about what you do every day, which is online talk therapy. And I think for all of the use cases for telehealth, virtual therapy and CBT online seem to have the most research showing the effectiveness compared to traditional in-person therapy. And it's probably also because of that, the most mature market for telehealth. How do you view kind of the space that you're working in now, which is very different from vascular surgery that you were doing previously?
So 74% of visits are telehealth. So the reason, there's multiple reasons. One, people like being anonymous. They certainly find it much more convenient. They don't have to schedule an appointment and go somewhere, sit in somebody's office. And there's a little bit of the stigma relative to being seen in somebody's office, whether it's a therapist or psychiatry. A lot of patients actually like not having, if they don't have to have the video, to be, as I said, a little bit more anonymous in terms of when they're talking and how they're talking to somebody. So there's a bunch of factors that have made telehealth therapy and psychiatry attractive. And then one of the biggest issues is as a patient, it's the only specialty where you really don't need to have a physician do a physical exam. And you don't need much, you don't need any equipment. So all of those factor into the issue about why it's so much more dominant than primary care medicine right now.
Yeah. I do talk therapy online. It's interesting that it was a therapist I used to see in person. We moved online during the pandemic, and I'm like, this is so much easier. And so it's convenient and get just as much out of it. So my N of one supports virtual telehealth, and I see the advantages to increasing access.
The other is, as you probably know, Talkspace did most of the original research, published 20 plus publications, peer-reviewed journals around why texting and messaging is a perfectly acceptable and effective way to deliver therapy. So the messaging is a big part of Talkspace still in terms of how we deliver therapy, especially in teenagers, because we're meeting them where they are, which is on their phones.
Are a lot of the users teenagers?
It depends on which part of our, I'll say, the country or the environment that we're dealing with. We are currently, Talkspace is now running what we think is the largest teen mental health initiative in the country. We have partnered with New York City, and Talkspace is now available to every single teenager in New York City between the age of 13 and 17. All 465,000 teenagers have access to Talkspace. So we know, based on the early data, that the overwhelming majority of them use either texting or texting and video, but it's overwhelmingly popular for students to use texting and messaging for therapy.
What are teens dealing with today that something like having access to Talkspace can support them on?
Sure. So the top 4 right now in the early 6-month data is anxiety, depression, and actually being yourself and self-aware is actually number 3, and number 4 is relationships. When you go further down the list, there's a couple of episodes of bullying, et cetera, but those 4 are really the big ones.
The anxiety, depression, I'm assuming a lot of it's stuff that has existed for decades for teens, but are there things that you're seeing that are exacerbated by the pandemic, by social media, things that didn't exist when we were teens?
So, I don't have the data about when we were teens, but the data is clear about the increase, unfortunately, in suicide ideation. So we also in Talkspace, we have a proprietary algorithm that actually monitors the conversation, and it alerts the therapist. It doesn't tell them what to do, but actually alerts the therapist based on the conversation that a particular individual may be at risk for self-harm. I will tell you that the suicidality and the thoughts of suicide in terms of our intake questionnaire for teens is very high. And it's in conjunction with what you see nationally on reported rates of interested suicide by teenagers. It's to me, it's unbelievable how common it is.
Yeah. It seems like a lot of the focus today, because of this, is on crisis intervention. What are you doing to kind of create a world where it's more about practicing mental health care to prevent any crises from happening in the first place?
So that's the key. That's, you hit sort of the nail on the head. The key for Talkspace and even the Teen Space therapy program is to educate people and teens, now seniors, about what a mental health journey looks like, what is important to their mental health, and then with ongoing therapy and talking to somebody is actually to avoid the crisis. Is to avoid that episode where it gets to such a point that something bad happens. So the idea is if you're talking to someone and they're always available to you, and either you message them or you do video, you actually prevent that crisis from occurring.
Yeah. And where does this all fall within just this broader movement towards value-based care? Like what I hear you saying is, avoiding crisis, like that would be something that you would think our health plans would want to incentivize. Yeah,
I think at least for therapy, we're having discussions, but it's early days for value-based care. More of the value-based care contractually, or what the payers are going to be asking for, is how soon can you get an appointment? How soon can you get a follow-up? Some data around tell us how well the patients are doing relative to clinical improvement. Those are more of the parameters that we're looking at now. And eventually that will evolve into something bigger, but value-based care and therapy is early days.
Yeah. Are most of your patients paying out of pocket, or is it covered by insurance? What's the model?
No. Well,
so
one of the, we know the big differentiators for Talkspace is Talkspace is the largest telehealth, mental health in-network provider in the country. So we now have 142 million people who could get therapy through their payers or through Medicare, so that you don't have to pay for it, or you have some small out-of-pocket copay. Yeah. That's been a gigantic change for us. So now when you look for therapy, we still have a consumer market, and you can pay $200, $230 a month, whatever that cost is, but the first thing we ask you is let us determine your eligibility. And now we just ask, oh, by the way, if you're in Medicare, we cover you. Once you do that, as you can imagine, there's a huge movement towards a fee-for-service, insurance-covered therapy provision. And that's what's happening in Talkspace now. So we will add many, many more lives throughout the next year or two, to get to a substantially even greater part of the American public will be covered.
But it is a subscription right? Like they are paying even if it's the health plan, it's a monthly fee for
No,
it is
the
as
health
used.
Plan, this is just like if you go to your primary care physician. You could sign up for therapy and start therapy with Talkspace anytime you want, and your insurance company will pay for it if you're covered.
Yeah.
It's just as if you went to make an appointment with your primary care doctor.
Yeah. What about the non-talk therapy element to it? You were talking a little bit about the other services on the app. Is that something that's free
also
then?
covered? No, it's also covered by your insurance.
Okay.
It's a very interesting model.
Yeah. Well, how is that covered? Is it covered? How do you measure utilization of something that's used asynchronously?
It's basically covered by the number of words and conversations that you have. There's someone a lot smarter than me figured out way before I got here, the algorithm with the payers to determine what actually generates into a 30-minute session or an hour session by using texting. Yeah, it's very cool.
Wow. That's really interesting.
Yeah, so we bill for the sessions based on the messaging and texting.
What about for folks that have to pay out of pocket, those that are underinsured or uninsured?
So we still have a pretty big consumer business. If they want to pay out of pocket, there's multiple ways to do that. And I tell people all the time, there's always going to be a consumer market because there's going to be, as you said, people uninsured. There's going to be people with high deductibles. And quite honestly, there's going to be people that regardless of what you tell them, they're not going to want their employer to know that they're getting therapy. So they just don't want, even though they're not going to know, there's a little bit of that, I don't want to go through my employer. I'd rather pay for it myself. So there's always going to be a consumer market. But our significant growth of the company is on the payer reimbursement side.
Yeah. But you still market direct to consumer. And because you have such a wide network of payers that are that you're in network for, you're able to go directly to consumer, advertise to them, and then they can sign up and see that it'll cost them nothing.
Yeah.
You're still a consumer, direct to consumer business in that way.
Yeah. The way that our marketing executive appropriately looks at it is we look at people, members, let's just say people out there who need therapy. For us, the issue is when we go to market, advertise, social media, whatever, our approach is to get people to want to find therapy. How they pay for it is the second step. So you first come to us, you need therapy, and then we say, okay, you can be a consumer and pay for it directly, or you can go to your insurance, or you may actually go through your employer, your EAP, your employee benefit plan, and get it through that way. So to us, it doesn't matter. Of course, the therapy is the same because the therapists all do what they do relative to delivering therapy. It's just a matter of how we get paid for it.
We'll be right back after the break. And how are you ensuring that the member experience is consistent as now the company is scaled and continue to grow? There are a lot of therapists that on the network, making sure that there's like a consistency of care delivered.
It's a great question. And I tell people all the time, our product is therapy. So, and that's one of our 4 key strategic objectives, meaning we have to deliver the best therapy network that we can. So first off, the average work experience for our therapists is close to 10 years. So it's a very mature network. Second, we spend a lot of time with the therapists in terms of what we call community education, communicating to them, making their lives better in terms of their workload, how they match and who they match to. So there's a lot of initiatives directed very specifically through our executive who runs the network and his folks to making sure that the therapists are happy. We grew our network 75% in the last year. We now have 5,700 therapists, and we deliver therapy in all 50 states. So it's a very, very important issue for us, is to make sure that the therapists deliver great care. And we do spend a fair amount of time trying to make their lives better. Yeah.
How does that work though? I assume they're contractors.
Both
and so,
contractors and employed. They're both. Because
I know that companies run into issues with contractors and that you can't be too prescriptive on how they do their job.
Yes, that's Yes, it's true. But therapists, I think, my impression so far is they really went into this because they like what they're doing. So I don't think, I know that there's no real difference that has emerged versus people who are quote 1099s versus full time. I mean, the work hours are different, and the amount of time they put in is different. But the quality of the service and who they are, I don't see big differences.
Is this their full-time job, or are they doing this on top of seeing patients in person at their regular practice?
So I've seen there's a couple of different models. A lot of them have a small practice on the side where they're seeing patients, and then they're using Talkspace in addition. There are a lot of them who I know are stay-at-home moms, and what they're doing is they're doing this part-time. In between nights and weekends, whatever they have time, they're doing it. Now, the interesting thing is because we offer messaging and text-based therapy, and it's asynchronous, they could handle a lot of patients because they can text and message almost anytime. So it does change their workload, how they distribute it.
Yeah, they could put the kid down for a nap and then go answer the questions, and offering that flexibility. I think that's a really actual great way to kind of support and help with the shortage of providers across the board. Is like, why don't we create more flexible work environments where there are options for folks who want to stay at home?
Exactly. I mean, there are therapists who could be texting and messaging 40, 50 people, just,
Yeah. Oh, wow.
Yes.
So I couldn't host a podcast in 2024 without asking about how you see the role of Gen AI and machine learning in the future of online therapy and anything that you guys are working on in that space.
So we've had large language models and analysis and AI basically for quite some time. We've had it in-house for as far back as before 2019. The algorithm that I talked about on the suicide risk is an AI large language. It was originally a large language model generated algorithm. So since we reported it back in 2019 and published it, we had 32,000 suicidal alerts.
Wow.
Now, having said that, we have leaned in on the AI initiatives. Now, what we will not do is offer AI therapy. We won't do bots. I'm very clear about that. I believe because I believe as a physician that the personal relationship between therapist and patient is very, very important. And that I don't want us to give that up. So we will not do AI bots and AI therapy. Now, the however is we are, because like the suicide risk, we are looking at multiple other entities where we can help the therapist actually be better at their job. Like saying, okay, this patient may be at risk for this patient may be at risk for this disease or this condition. So that's where the AI has been becoming very, very helpful. The other part is I just talked about it, is by looking at the spectrum of notes on, let's say, a weekly basis, we're able to provide a comprehensive summary to the clinician, to the therapist, about what's happened to the patient over a certain period of time. We've actually quantified that, and as of a couple of weeks ago, we know we're saving the therapist about 4 hours of administrative work a week by providing them these really, really excellent summaries that are AI generated. Yeah. We also are beginning to look at intake summaries so that they know who and what they're talking to. And we'll probably begin to use it to provide an even better matching algorithm for patients and therapists. We're also using it on the business side, but those are some of the initiatives that we have going on right now.
Yeah. I've seen in other areas of healthcare, there was like a study on the EMR where AI helped kind of create the response in the EMR to patient questions. And then the clinician was able to kind of edit, approve, and send. Is that something that you think could be a valuable use of AI?
Yes. So we're looking at it, but the important thing is what you just said, is nothing goes out without the therapist reading and correcting it.
Yeah. Yeah, of course.
Absolutely. They have the final sign off.
Sure. I mean, if I recall correctly in the study, I'll have to dig it up and send it to you. It actually didn't save time at first because the voice was so different that they spent all this time editing for voice. Because there was like, oh, this sounds too, like there's too many exclamation marks. I would never use that many exclamation marks. It's like kind of spending time tweaking for style. So I wonder though, if there's a way to kind of evolve where it's actually being trained on that specific clinicians, like this is how they generally respond to something like this and kind of help create that autopilot response that they can then send or modify.
All of it's going to evolve. Let's put it that way.
Yeah.
People will get used to it. People will get over it. Things will get better in terms of just, understanding how people talk. But I think that's all an evolution.
Yeah. Do you have an AI team?
Yes, we do. Yeah. It's
How big
in-house.
is it?
Well, we have I don't know if we've disclosed how many. We have roughly 60-ish engineers that are on the IT platform in general. Then I can't tell you specifically how many people are just doing AI.
A number of them.
It is a separate team, though.
Yeah. It's an investment
Yes.
that you're making. Yeah.
We have and continue to invest in. That's correct.
Yeah. How important is the actual product, the software versus the service that's underlying it? And how do you think about investing in both of those things?
So Talkspace has its platform has all been generated in-house. So there are certain functions that we certainly can outsource, but our tendency is if it has anything to do with the product, our preference is to write the code ourselves right now. Now that may change, but that's our view right now because it is our platform. We are really, really sensitive to the issues about data security. We are very, very sensitive about HIPAA. So all of those are important issues before we make any decisions about what we may or may not give out.
And do you think of software as just like the means to the end, which is great therapy?
No, I don't know if I think of it one way or the other. I think it's just part of who we are.
Is there a feature that you think is the coolest and really differentiates Talkspace that you're really proud of?
I think that to me, the suicide algorithm is really, really important because it really does. It's 84% accurate, but as I said, we've had 32,000 suicide alerts since 2019. I can't tell you because we can't follow patients or when they leave, where they go, it's all the hip issues. So I can't tell you how many lives we've saved as a result of that, but I'm sure that we've had a fairly significant impact on a bunch of people's lives. Yeah.
Yeah. So switching gears a little bit, what is it like running a public company?
So I would say it's difficult with respect to the amount of, regulatory environment. And it costs money, as you probably know. It costs a fair amount of money to run a publicly traded company. That's money right off the bottom line.
Yeah.
So there is a financial impact of being publicly traded as opposed to private. I think one is the regulatory oversight. I do think that I spend a fair amount of my time with the investor community, which is what, I'm supposed to do.
Yeah.
But it's a lot of time talking about the company, talking about the stock performance, talking about where we're heading, talking about strategic initiatives. And then the purpose of that, of course, is to get people interested in investing in the company, which is what you do as a publicly traded CEO. But which you've heard, I'm sure, a zillion times before, but the quarter-to-quarter performance is a constant drumbeat, as opposed to long-term.
Yeah.
So you try and make long-term decisions, long-term investments, but you are absolutely held accountable for what happens quarter to quarter.
Yeah. There are a couple of telehealth comps, but you guys are really the only mental health telehealth company that I know of on the market. Do you feel like Main Street investors get it? Do they get the business?
So I would say somewhere around 7 months ago, 8 months ago, I think the investor community woke up to Talkspace. We were a de-SPAC, we were IPO, no secret, got crushed on the IPO. A lot of things
before
happened.
Your time.
before my time. The founders, they had to move the founders away, and they went through all that restructuring. But because we are really the only telehealth mental health network provider in the country, because we have 140 million covered lives, which will grow substantially as we add all the other Medicare lives and then Medicare Advantage and then more of the Blues, et cetera. And the model is working. And last quarter, we were profitable for the first time in the 13 years of the company.
Congratulations.
Thank you. The interest in the company really began to take off about 6-7 months ago you can just call it as a SPAC survivor. So plus, by the way, we have
SPAC survivor. I like that term.
That's true. Plus, we have 120 million of cash with no cash burn. Mm-hmm. So, we don't need money. We don't need to raise. We're not burning cash. We have a lot in the bank. We're growing substantially, and we're profitable. So, the stock has gone from basically 70 cents to close to $3 in the last year and a half. Yeah. And I think that's because people woke up. I mean, the investment community said, okay, this is real. And so we've had a lot of people talk to us.
Yeah. Yeah. What's the revenue at now?
We reported 150 billion last year. I've given guidance publicly for this year to be between 185 and 195 million. And our EBITDA margin will be somewhere between 4 and 8 million for the year.
So one of the largest 25 publicly traded digital health companies now.
That data point I don't know, but I probably. Yeah.
So we have a lot of clinicians that listen in on the show, and I'm curious what advice you have for them, for those that want to be in your shoes in 10 years.
I just gave a talk recently. It was called Chairman to CEO and From the Operating Room to the Boardroom, where I specifically discussed what the journey has been for me, and particularly what it would take for people to get there. There's a lot of things that people would need to do. Not a lot, but really important ones that really make a difference if they want to get onto this trajectory. And I also warn people about whether or not they want to do it. I tell people all the time, successful clinicians frequently does not translate into successful leaders. There's a really big difference between running a successful practice and being a really successful leader. So there's a lot of issues around that.
Is it something that it's innate that like you either are going to be good at going to the private sector, or do you think it's something that people can figure out and learn?
Oh no, you can absolutely figure it out and learn. It's just the decisions about whether you want to do it, and if you want to do it, what you need to do, and really laying out a strategic plan. Yeah. About how to get there. And it's, as I said, it's very doable, but it's not something that you're just going to wake up one day and say, I want to do this. I mean, you really literally have to look in your mirror and say, okay, do I really want to do this? and what's it going to take? And then go from there.
It's just last question that I always like to ask my guests is, if you could wave a wand and change one thing in healthcare, what would it be?
So there are 3 big topics in healthcare that people always talk about, and that is quality healthcare, coverage, and cost. So it would probably be something maybe in each category, but I would say that we have never really addressed the cost issue in healthcare for a variety of reasons. And the quality issue is also, I hate to tell you, it's a complicated answer.
All right, Jon. Well, thank you so much for being here with us today.
Thank you for your insightful questions. I really appreciate it.
Thanks for listening to The Heart of Healthcare. If you enjoyed this episode and you'd like to support the podcast, please leave a rating and review, and don't forget to subscribe. The Heart of Healthcare is produced by Hallie Tecco and Steve Krause. The show is engineered, edited, and mixed by Kyle Moore. Visit our website, heartofhealthcarepodcast.com, for show notes and episode details.